Hi, welcome back to another episode of the Medical Minute. I'm Jill Hunt, and today with me is Mandi Reid. Mandi is one of the newest additions to our team, and she staffs down at our Naples office. So welcome, Mandi.
Thank you, Jill.
So today we are going to be talking about testicular cancer because testicular cancer is one of the highlighted cancers for the month of April. And so today we're really going to kind of dig into kind of an overview of testicular cancer, early stage disease, some of the issues that we see from a clinical side in regards to early diagnosis, and even talk through some of the potential treatment options when men are diagnosed with later stage disease with testicular cancer. So I am going to start off just for the sheer fact that I had a personal run-in with testicular cancer. My oldest son, when he was 25, was diagnosed. And it's funny because we talked about the fact that because we have such a close relationship and he had no problem calling his mom and saying, "Hey, I got a problem." It really did help expedite the workup for him and what ultimately happened. So I need to give a little disclaimer as we are talking about testicular cancer, how it impacts men, specific situations. We're keeping it real because the reality is this disease hits men more commonly between the ages of 20 and 40. And a big part of the problem with this and missing early diagnosis is because, and we love our men, but they don't tend to talk about things.
No, it seems to be taboo to talk about men talking with other men about their own health. You know, women as a whole will talk with their female friends about what's going on with their bodies, if their breast health, if they're having any issues, things like that. But men don't go to each other and say, "Hey, I'm having trouble with some pain, some swelling in my testicle," or, they just don't tend to talk with each other like women do.
Right. So in my situation, my son had called me on a Sunday night and he said, "Mom, I got a problem." And I said, "Okay, what's the problem?" And he said, "I got something wrong with one of my balls." Which is not something that every mother would expect to hear when she gets a phone call from her son.
Definitely.
And I said, "Okay, well, let's talk through this. What's the problem?" And he said, "Well, one of them is firmer than the other." He said, "And it's sore." And I said, "Okay, well," and I started talking to him from a very clinical standpoint. Like the most common cause of a firm, swollen testicle, especially in young men, is epididymitis, or it could be an infection or some other cause.
Definitely. Was cancer one of the things that immediately went through your mind?
So for me, yes, because I live this world. Mm-hmm. So, but I also went back to all of the things that it could have been other than cancer. And so when I talked to him about that, I talked to him about some of the most common causes of epididymitis. And this is where we might get a little taboo and make people cringe a little bit. But in young men, if there is a overabundance of masturbation, you can actually cause epididymitis or inflammation in those pathways that the sperm take to exit the body. And so, of course, I said to him very directly, "I'm going to need you to stop doing that for the next few days." And he, of course, like most men, says, "Well, I don't do that." To which I giggled and said, "Yes, you do. But I need you to stop, and I need you to also, let's try some ibuprofen. Let's see if we can get some inflammation down, and let's check in a few days." And so, because I'm a mom and I was his mom, within about 3 or 4 days, I called him and said, "Hey, how are things going?" And he said, "No," he said, "it's not any better. I've been taking the ibuprofen around the clock. And if anything, I'm noticing it's more sore." That's when all of my radars went off. And so I called a friend of mine who was a urologist, and I said, "Hey, I've got my kid already diagnosed with testicular cancer, but I know it could be these other things. Can you walk me through this? So he ended up seeing my son and started him on some antibiotics and ordered an ultrasound. 9 days into the antibiotics, he had the ultrasound, and the ultrasound showed a mass. And so he was seen by the urologist, and my urology friend called me and said, this was not the conversation that I expected to be having with you. And I said, I know. I said, but I had a gut feeling before we started any of this. And so he went in, and within a week, he was in surgery, had the testicle removed, had the mass removed. And the urologist said, this is the earliest stage of testicular cancer that I have ever found. And what we do know about testicular cancer is that it has it's 98 or 99% cure rate if it is caught early. So for my son, all he had to do was surveillance imaging. There was no chemotherapy, there was no radiation, there was nothing else after the surgery. And all because he had the wherewithal to pick up the phone and say, hey, Mom, something's wrong. So I say all of this, kind of in just a little bit, but the fact that he didn't have a problem calling his mom and telling her that there was something wrong with one of his balls was really ultimately what saved him from going through a lot deeper treatment, more intense treatment than what he would have had to have. So as we kind of talk through this, it really is one of those cancer diagnoses that, as we've talked about most of our cancer diagnoses, if you catch it earlier, it is so highly treatable.
Definitely. And I know, that's, from one side, from a younger gentleman. I've got good friends that recently he was diagnosed with testicular cancer. Similar story in a lot of ways, but different in a lot of ways as well. My friend's a PA working in oncology. Been married for a while. They have 3 kids. He's got 2 other kids as well. Beautiful family. And, he was commenting one day just in passing, that his, to use the term that was used, his ball sack hurt. And she's like, okay, when did this begin? And he's like, well, it sounds like about after my vasectomy. And she thought about it. The vasectomy had been 2 years. And so at that point, as a wife, it's like, okay, this has been bothering him a while, okay. And he's got kids that are at just that height to hit him in that area frequently, so he gets hit frequently. And so really didn't think anything about it, just kind of a suck it up buttercup, keep going on moment like most wives would do. And, didn't really mention much of it for a while. Maybe it's just hurting here and there, but he knows he was hit again. And, unfortunately that area is just that right area with kids. And right before Thanksgiving, things just got worse, and he called her, and he's like, hey, something's changed. I've got to go to the ER. And he went to the ER and ended up being diagnosed or being told he had a mass, and was in surgery shortly after that, and had one of his testicles removed. And for him, it was a later stage. He had masses in his lungs as well, but also very curable, even though with testicular cancer, it's one of the few that when it's found a little later is also potentially curable still. Look at Lance Armstrong with the testicular cancer that had metastasized to the brain. You don't hear of many cancers where it's gone to the brain and it's still potentially curable. So for him, this is this big strapping guy, and, the chemo hit him. The chemo hit him hard. He went through 4 cycles. Strongest person I've seen go through this treatment. The 3rd cycle, like most, hit him very hard. And, they got through it, and now scans are good, and, prayers that they continue to be good. But there's a lot of things, even after surgery, wasn't allowed to lift the kids. And so, it changed family dynamics for a while from that standpoint as well. And so, even working in oncology, our first thought isn't always, this is a cancer. And, it could be this, it could be that. There's so many different things could be. And testicular cancer is one of the rare cancers, and it's something that needs to be brought more to the forefront, and people talk about it more.
Yes. So, common symptoms of testicular cancer: pain, swelling. One testicle is larger than the other. The firmness of the actual testicle itself is firmer one compared to the other. If things have potentially progressed, you can get kind of a lower abdominal fullness or heaviness in not just the abdomen, but also in the actual scrotum. You can kind of get a fullness sensation there. So it very much is, if there is anything different for our male population, it is better to have it checked sooner rather than later. Don't worry about the stigma behind, if there's something wrong. It's better to be safe than sorry. The nice thing is that in a lot of cases, it can be an infection that can just be treated with a course of antibiotics. But if it's not, you want to catch it early.
Definitely. And a good friend of mine, when she was talking to her teenage boys, one of the things she was saying, wanted to make sure they were looking out for their own body health and things like that at an oncology nurse. And, she told her teenagers, check your McNuggets. What do you say to teenagers to make them listen to you? Well, you call them McNuggets, and, make sure you check them if there's anything different, and, just make notice of it, and because this is real. Yeah. And, start with the kids when they're teenagers and tell them this is something like you do with women. Women, you start talking about breast cancer and everything else early. The men, the peak age is between 20 and 40 for testicular cancer. As teenagers, when you're talking about other health, other things, talk about their testicles, talk about testicular health with your kids.
Yep. And kind of like I've said on a previous podcast or a previous Medical Minute, make it weird. So, the reason that we were able to find my sons as early as it was is because we had those conversations. He was comfortable coming to me and having that conversation because I had made it weird his entire teenage life. Like, we talked about these things. So, just make it part of, if you are a parent with boys and especially teenage boys, have those conversations. And if you're a young adult, really, in all honesty, be aware of your own health and don't be afraid to have the uncomfortable conversations.
And make it okay to talk with your friends about it. There's no reason, as males, you have to be so strapping and masculine that you can't talk to your own buddies about your health as well. Women do it all the time. Men should make it natural to be able to talk to their friends about what's going on with their bodies because they can help each other like women do.
Yeah, absolutely. Well, Mandi, thank you for your appearance on your very first Medical Minute.
Thank you.
And we will see you all next time.